How does exposure therapy treat trauma? Imagine facing your fears in a safe and controlled way, gradually learning that what once caused intense distress no longer has the power to overwhelm you. That's essentially how exposure therapy helps treat trauma, especially post-traumatic stress disorder. The core idea is to help the brain unlearn the fear responses tied to traumatic memories or reminders. In practice, exposure therapy involves carefully and systematically exposing individuals to trauma-related stimuli or memories. This can be done through imagining the traumatic event, confronting real-life reminders, or even virtual reality simulations. The goal is to help the brain become less reactive over time, which is called desensitization. Repeated exposure helps reduce the automatic fear response, making triggers less distressing. As this process continues, emotional reactions diminish, leading to habituation, where the individual no longer reacts as strongly to trauma cues. Another key mechanism is the extinction of fear associations. When someone experiences trauma, their brain links certain cues, like a place, sound, or smell, to danger. Exposure therapy helps break this link by repeatedly confronting these cues in a safe setting. Over time, the brain learns that these reminders are no longer dangerous, reducing the power of trauma triggers to cause distress. Emotional processing is also a vital part of this approach. Confronting traumatic memories allows individuals to process and integrate their experiences instead of avoiding them. This can help reframe their understanding of the trauma, lessen emotional intensity, and correct any distorted beliefs they might hold about what happened. Building confidence is another benefit. As people realize they can face trauma-related situations without catastrophic outcomes, their sense of self-efficacy grows. This empowerment helps them manage anxiety and trauma symptoms more effectively in everyday life. There are different methods of exposure therapy. Prolonged exposure therapy combines imaginal exposure, where the person recounts their trauma repeatedly, with in vivo exposure, which involves gradually confronting real-life reminders. This approach often includes trauma processing and breathing exercises. Systematic desensitization involves gradually increasing exposure to trauma cues while practicing relaxation techniques to ease anxiety. Flooding is a more intense method where the person is exposed to triggers all at once, aiming for rapid desensitization, but it can be more distressing and is less commonly used. Narrative exposure therapy involves creating a detailed written account of the trauma, helping to contextualize and process the experience, often used with groups like refugees or survivors of multiple traumas. It's important to note that exposure therapy is based on the idea that trauma-related fear is maintained by avoidance and conditioned responses. By intentionally and safely confronting these fears, the therapy helps weaken the learned associations and reduce symptoms of post-traumatic stress disorder. However, because trauma is complex and individual, exposure therapy should always be conducted by trained mental health professionals to ensure safety and effectiveness. It's not about forcing someone to relive trauma but about purposeful engagement to promote healing. In summary, exposure therapy treats trauma by helping individuals face their fears in a controlled way, reducing avoidance, weakening harmful fear links, and encouraging emotional processing. This process can significantly lessen post-traumatic stress symptoms and support recovery, but it's essential to approach it with professional guidance tailored to each person's needs. If you or someone you know is considering this treatment, consulting a qualified mental health provider is the best step towards safe and effective healing.